everyone. Welcome to the Acushnet School Committee meeting on Tuesday, November 10th, 2020 at 5:30. Per Governor Baker's order suspending certain provisions of the open meeting law, the public will not be allowed to physically access this school committee meeting. Members of the public can access the meeting via live stream, and that link is located at the town's website as well as the school's website. In addition, the events will be rebroadcast on the local cable access channel. The school committee reserves the right to implement additional remote participation procedures and will notify the public of these procedures as soon as practicable. We're going to call this meeting to order. And again, this meeting is being video and audio recorded for cable broadcast. I will begin this evening with the approval of minutes, payroll, and warrants. If I could please request a motion, please, of approval of the school committee minutes of October 6th, 2020.
So moved.
Second.
Any discussion? Seeing none, we'll go into a roll call vote. Mrs. Benavides?
Mrs. Gomes?
Yes.
Mr. Sumner? Mr. Sumner?
You're on mute, Craig.
Sorry. Yes.
Okay, thank you. Mr. Tebs? Did he say yes?
Yes.
Oh, thank you. And Mr. Hood?
Yes.
Mrs. Downing?
Yes.
Thank you.
Okay. Moving into the approval of payroll and warrants, if I may request a motion for approval, please.
We'll make a motion.
Second.
Any discussion? Okay, seeing none, we'll move into our roll call vote.
Mrs. Gomes?
Yes.
Mr. Sumner?
Yes.
Mr. Tebs?
Yes.
Mr. Hood?
Yes.
And Mrs. Downing?
Yes.
Thank you.
Okay. We have no old business, so moving on to delegation. Comments are welcome during the public comment segment. Please forward all comments to the recording secretary, Kelly Benavides, at kellybbenavides@acushnetschools.us. And I know, Ms. Benavides, we do have a comment that came in earlier.
Yeah. You want me to move forward with that?
Yes, please, and that will also give us some time for others to come through.
Sure. So our first delegation comment is from Lisa Carvalho, and it reads, "Dear Madam Chairperson, Dr. Bailey, and members of the Acushnet School Committee. My name is Lisa Carvalho, and I am the kindergarten and first grade special education teacher and the ATA president. I am requesting that this letter be read at your school committee meeting on November 10th, 2020. As an Acushnet educator and ATA president, I support maintaining the current mask policy and social distancing protocols as instituted by the Acushnet Public Schools at the start of the 2020-21 school year. I have several concerns and reasons why I continue to support the APS mask policy that has been in effect since October 5th when we started the high school plan. Stakeholders had opportunities to participate in and provide input for reopening plans prior to the school year and implementation. Staff returned to work this school year. Excuse me 1 minute. Back to delegation. Do you mind if we go back to delegation for a minute?
What is it? I can't hear. You want me to read it? Yeah. Okay. Okay, so I'm gonna read it because I guess she's having an issue with her throat. So I'm not sure where she left off, but it sounded like she was at the beginning. So, dear Madam Chairperson, Dr. Bailey, and members of the Acushnet School Committee my name is Lisa Carvalho, and I am a kindergarten and first grade special education teacher and the ATA president. I am requesting that this letter be read at your school committee meeting on November 10th, 2020. As an Acushnet educator and ATA president, I support maintaining the current mask policy and social distancing protocols as instituted by the Acushnet Public Schools at the start of the 2020-21 school year. I have several concerns and reasons why I continue to support the Acushnet Public Schools mask policy that has been in effect since October 5th, when we started the hybrid plan. Stakeholders had opportunities to participate in and provide input for reopening plans prior to the school year and implementation. Staff returned to work this school year with the promise of science-backed mask usage and social distancing policies that would ensure students and staff, and by extension, the community, stay safe and healthy. Plans were developed with guidance from state and local public health professionals. The CDC and recent studies verify that diligent mask use is vital in preventing the spread of COVID-19 infection. Acushnet is now rated red, high risk, by the state based on increasing COVID-19 case numbers. The positivity rate as of 10/30/19 was 5.07%. Though protocols will eventually evolve when it is safe to do so, changing the established mask and social distancing protocols at this time is unnecessarily risky. The month of October ended with 62 positive cases, our highest monthly record to date. Students and staff are implementing these policies and protocols cooperatively. Time for mask breaks is worthwhile for the health and well-being of students and staff. Breaks can be managed effectively with the collaboration of building administrators and staff. Mask breaks are scheduled such that individual class groupings are separate and monitored. Classroom area ventilation and social distancing space is not adequate or safe for frequent indoor mask breaks or food breaks. Current protocols and policies, including mask wearing for students and staff inside of classroom areas, will help us to continue in-person learning, which we know is so important for students and families, and do so safely for all. Increased risk for staff from exposure to individuals without masks could require staff members to be put on quarantine or sick leave. Staff shortages could require school closures, interrupting face-to-face learning for students. We depend on administrators and the school committee to do what is best for the health of students and staff and the entire community based on science and recommendations from healthcare professionals, not on popular, vocal minority, or political opinions. Governor Baker issued an order effective November 6, 2020, requiring face masks or cloth face coverings be worn in all public places, even when they are able to maintain 6 feet of distance from others. The revised order still allows for an exception for residents who cannot wear a face covering due to a medical or disabling condition, but it allows employers to require employees to provide proof of such a condition. It also allows schools to require that students participating in in-person learning provide proof of such a medical or disabling condition. A survey was completed by the ATA, that's the Acushnet Teachers Association, in October. The results are as follows. 96 staff and faculty filled out the survey. 82 people feel staff should wear masks at all times. 82 people felt students should wear masks at all times. 85 people felt it was important to maintain 6 feet social distancing with masks. 11 did not. 85 people felt it was important for students to wear masks in classrooms at all times. 11 did not. 88 people felt it was important to limit exposure to students and staff. 8 did not. 90% would not alter the Acushnet Public Schools mask policy at this time. 90% would not feel comfortable working with students face-to-face without masks. As you are aware, the Acushnet School Committee and ATA reached an agreement in September 2020 that contained an MOA specifically on COVID-19. Articles 1 of our MOA states that, quote, the ATA agrees to adhere to the conditions set forth in the final and approved reopening plan as determined by the Acushnet School Committee by affirmed vote. And then Article 23, quote, the parties agree to reopen negotiations and amend the terms herein as appropriate in the event of future applicable legislation, regulations, and order of guidance. Please be advised that health and safety is a mandatory subject of bargaining, and so the unilateral implementation of policies contrary to our agreed to MOA will amount to an unfair labor practice. Please cease and desist from any implementation of policies that violate our MOA. The ATA will not hesitate to take the appropriate legal action if and when it becomes necessary. The health of our students, staff, and community should not be based on convenience and is not a social experiment. Educators deeply care about our students and our community and want to ensure that everyone can continue to learn and work in a safe and healthy environment. Please do the responsible thing and keep the current mask and social distancing policies in place for the time being. Respectfully, Lisa Carvalho, ATA President.
Okay, thank you, Dr. Bailey, for reading that. And Ms. Benavides, do we have any other comments that have come through this evening? All right, moving along to our next agenda would be new business, and I'll hand it over to Dr. Bailey for her superintendent's report.
Thank you. Mine's very brief tonight. You have in your packet personnel matters. Since our last meeting, we've hired 2 new staff members. One is a building-based substitute at the elementary school and a substitute custodian. So does anybody have any questions about the personnel report? Okay. And then we have a mentoring program that continues to happen in the district, in all districts, really. So I thought it was important and timely that Ms. Betancourt give us an update as she leads this initiative in our districts, just to give people an idea of what it's about and what we do with that. So with that, I'll turn it over to you, Ms. Betancourt.
Great. All right, I'm going to share my screen, so hopefully you'll be able to follow the presentation. All right, can everybody see that? Okay, perfect. So as Dr. Bailey said, we have a mentor program, and through Department of Education, every district is required to have a mentor program for new teachers to the profession, as well as new teachers to a school district. It's a big part of teacher preparation, and it's a big part of onboarding a new staff member to our district. So prior to me coming into Acushnet, we did have a mentor program. It wasn't, I would say, up to par with what the expectations would be. It checked all the boxes, but I don't think that there was enough enrichment going on in the mentor program. So Dr. Bailey and I decided we would tackle this last year. And I think it's going to be a work in progress. You know, as the years go on, we'll continue to build to this program. But I figured it was a good time at the beginning of the school year to really launch this and talk about this with school committee so that you're aware of some of the things that happen in the district for our new employees. So every new employee is assigned a mentor, and they provide support and direction for the first year teacher and a beginning teacher. And as I said, the first year teachers are those maybe on initial or provisional license. They do have a requirement to have mentoring for that first year. And then a beginning teacher is just somebody new to the district, and we want to give them proper onboarding. There's a lot of dimensions to mentoring. A lot of people think it's just a very regularly scheduled session where it's very formal, but really it's a lot of different things that go into the mentoring relationship. Advice is one of my favorites. You know, as a new teacher or new to the district, it's nice to have that point person that you can feel comfortable going to with questions or advice or to bounce ideas off of. It helps our teachers really gain good success in that first year. It helps them kind of navigate through the policies, the procedures, the way of doing business in our district, culture, curriculum, and all different aspects of that. The mentor provides some level of coaching. So again, if you're a new teacher to the field, that mentor is generally a seasoned veteran teacher who's had some nice experiences that they can share with a new teaching employee or a new teacher. Again, that support of just having somebody to say, I had a bad day, and you know, the mentor saying, I've had those myself. We'll, you know, regroup tomorrow and let's give it a shot. helping to work on goals, whether that be formal goals through the eval process or just really setting target goals as a new teacher or new employee. And then again, assisting with some of the training and the professional development that we offer through the district. There are certain requirements that the department puts on us as far as a mentoring program. So a mentor facilitates the strong start to the school year. The mentor can help beginning teachers launch into a productive year by making sure that they're able to obtain all the materials, familiar with routines and schedules, and help them with curriculum expectations. The mentee is really expected to play an active role in this relationship. It really should be the mentee and the mentor having a reciprocal relationship where the mentee reaches out, the mentor checks in, and it's really a cyclical type relationship. The mentee should be offering critical reflections on his or her own practice and identifying areas where they would need assistance. The mentors are really well equipped to be helping those new teachers. A beginning teacher may also decide to share elements of his or her evaluations, discuss goals, and maybe talk about any feedback that they've received from their direct supervisor. The mentees or the new, beginning teachers should regularly participate in the programs that we've organized for beginning teachers, and I'll go into those a little further into the presentation. We do have peer support groups. Those are our mentor meetings, those professional learning communities and learning opportunities, which we have throughout the year. There'll be workshops available to the beginning teachers, and there's also opportunities for them to share their expertise with colleagues and contribute to the school culture and professional collaboration. All new teachers, beginning teachers, anyone that's in their initial or provisional license is required to participate in at least 50 hours of mentored activities for their first year of teaching in order to move from an initial or provisional to a professional license. What we love most about the mentor program is really the impact that it has on students. We can always put training programs in place for staff, but it's really about the teaching and learning and the effective engagement that new teachers are able to get through this program. That we want to put the best teachers in front of all of our students. Every day is an opportunity for great teaching and learning. And by having a program like the mentor program, we're able to really support those new and beginning teachers very strongly in that first year, which gives them a lot of tools to be able to be effective teachers. So I wanted to put a slide in just to show you what our goals are of the mentor program and how that impacts children. So, again, with the effective teaching, new teachers often need support to learn lesson planning, curriculum design, and all things that you will need to learn as a new teacher. This is a great way for them to do that individually with the mentor, as well as at our group meeting times and workshops that we have. First year teachers generally have limited experience in being the sole provider of curriculum and instruction in a classroom. Most times we see they're coming right out of school or early experiences where maybe they've been a practicing student or they've been a substitute and really haven't had the full range of responsibility that a classroom teacher has from start to finish of the school year. So this is a nice way to support that learning in that initial responsibility period. Having someone to just observe as a non-evaluative person is a nice way to be able to try new things and experiment as a new teacher. And the mentor provides that if the mentee requests that. And beginning teachers are more apt to take risks and try new things if they feel that they're supported. And again, it's difficult when it's a supervisory relationship because I think new teachers feel like they're going to be evaluated or judged if they try different things and they fail. Having that relationship with a mentor really does allow them to take those risks and try things in a more safe setting to get just some helpful feedback. By having these mentor-mentee relationships, we're also trying to garner strong student engagement. Mentors are able to assist the mentees with setting a culture for the classroom, and it's a nice way that they can share experiences of what worked and what didn't work as they became more seasoned mentor teachers. Beginning teachers seem to work really hard to establish a rapport and build relationships with their students. And again, the more comfortable we can make them, I think this is something that they can really focus on and make as a main goal for their first year in teaching. And having that mentor teacher helps the beginning teacher find success with classroom management and building student confidence and self-esteem, which, if you remember, is one of our district goals, both last year and this year, is really around SEL and that really social emotional health, building confidence, independence, and self-esteem. Again, more benefits to the mentor program. The mentor does get to make a positive difference in someone's life. We were all new at our professions at one time, and those of us who maybe didn't have that person that we could feel comfortable going to for just about anything, I think it makes a huge difference when you have the opportunity, again, not a supervisory person who's more of an evaluator, but somebody who's just a peer that you can bounce ideas off of and feel that support. Again, it's a connection to the institution and to the students. We're molding our next leaders by giving them a solid foundation with our district. We're giving them one-on-one availability of another professional. We're building long-term relationships with faculty and staff, and they're receiving specialized supports and resources. And it's really an exchange of ideas and knowledge, which is a wonderful relationship. I wanted to just give you a quick slide on what our mentor support team consists of. We all have a role in the mentor program as administrators in our buildings. So Dr. Bailey, her role is really to endorse the induction program, ensure that there's facilitation of all the required elements of the program, and that we do meet the requirements and provide this to all of our new teachers and new employees. I function as the district's mentor coordinator, so it's my role to facilitate the induction and mentoring program. I run all of the mentor support meetings, I manage the requirements of the program, and I maintain all the necessary documentation for both our mentors and mentees. And the principals really are helping to facilitate the relationship between the mentors and the beginning teachers. We want our principals to ensure that they have time to meet regularly. We know time is a commodity these days, so principals are doing their best to be able to ensure that there's time for the mentor and the mentee to get together. They're also encouraged to meet regularly with the beginning teacher to gather feedback on how the program's going and what are the supports they may need. Another big motivation to have a mentor program is really there's a lot of evidence that shows that teachers who have a strong mentoring program as they're either onboarding as a new teacher to the profession or onboarding to a new district are more likely to remain with that district for a longer period of time. I know in education we really strive to have strong teacher retention. Turnover is not a productive issue that we want to have. We want our students to have consistent teachers in front of them. We want to build that capacity in all of our teaching staff. So strong mentoring programs really do show that there's stronger teacher retention in districts that have a strong mentor program. So I didn't know if anybody had any questions that around the program that I could answer, comments.
Yes, Ms. Betancourt, I just want to add that mentors actually have to take a special course. Is that correct?
Mm-hmm. Yes, they do. Yeah. Not anybody can mentor. They have to go
Right.
through a certified mentor program in order to learn, all of the elements of the mentoring, what's required, and all the requirements.
And I can just add that since I've been in the district, I have definitely seen that program get stronger as time has gone on, and we will continue to strengthen the program. Right now, our teacher retention rate is very good in Acushnet. And I love the meetings and the relationships that are forming, and I say thank you very much for everything that you've been doing, Ms. Betancourt. Does anybody else have any questions for Ms. Betancourt?
I'm just curious, who does the pairing up of the mentor with the teacher, and how do you do that?
So I usually work with the principals. We try to find similar grade levels, similar background. So if it's a special education teacher, we would want another special education teacher. If it's an early childhood grade, we would want to find somebody of the same grade or similar grade level, so that it's apples for apples, and they feel that they're getting information and support that's relevant to the grade level and the content that they're teaching.
Mr. Sumner, you had a question?
How many certified mentors do we have in each school?
Oh, I don't know if I could give you that off the top of my head. I think we're probably around 20 or 22 at my last count.
Total.
Throughout the district?
All schools for the district,
Total.
yes.
Okay.
We haven't had a huge need. I mean, thankfully, we're in a district that we don't have a lot of turnover. Mostly it's new staff that we're either adding a position and they need that support. This year, we actually have quite a few less mentors and mentees because we do, as a district, we have a 2-year mentor program. So the first year is a very formal mentoring program that meets all the requirements. We feel strongly that a mentor really should be in place for the second year. Again, there's not a lot of requirements in the amount of hours and the meetings you have to attend, but just having that safety net of that person for a secondary year, I think really makes a difference for us. So a lot of our staff this year are in their second year of the mentoring program, and they'll be finishing up with that formal support this year, which will probably leave us with, I think, about 6 staff for next year in their second year of mentoring.
Any other member questions? All right. Thank you for that report, Mrs. Betancourt.
Thank you. My last thing actually is more of a quick update because I wanted to update you on a few things that have occurred since the agenda was posted regarding our hybrid model and updates to guidance on the health metrics, which came out on Friday. So people may be aware that the Department of Public Health and designated and DESE issued an updated guidance interpreting the new metrics for communities for COVID-19. And they basically discussed that there's a growing body of evidence that students should remain in school and that schools are able to operate safely with strong health and safety protocols. So the gist of the updates is that districts are expected to prioritize in-person learning across all color-coded categories unless there is suspected in-school transmission in accordance with DESE's guidance on responding to COVID-19 scenarios. Districts and schools and communities designated gray, green, or yellow are expected to have students learning fully in person if feasible. Schools in red communities should implement hybrid models while maximizing in-person learning time for the high-need students. And then in those communities with the highest COVID caseloads, DESE and DPH will be working closely with them to implement customized strategies to reduce the in-school health risks. Fully remote instructional models should be implemented only as a last resort, and student learning time requirements for students and related regulatory and statutory standards remain in effect for school districts regardless of what model we're using. Now, over the past few weeks, we've had several meetings with the Commissioner of Education, and they've actually done quite an extensive data collection from each district on the number of hours, people are having the teaching and learning. I feel that Acushnet is in line with what we've put in place, what's been mandated and regulated by the state officials. So I feel very good that our students, even on their remote days, are getting uninterrupted learning. Today, MASS put out sort of a statement, which I think sums it up. And then after I read the statement, I'm just going to quickly let you know where we are at and how we plan to move forward based on this new information. So the Massachusetts Association of School Superintendents put this statement out today. During the past several days, many superintendents have expressed concerns with the governor's press conference on Friday, November 6th, when he set expectations that schools and communities designated as gray, green, or yellow return student learning fully in person if feasible. Clearly, the words "if feasible" are key to any possible return of in-person options. Based on the guidance provided by the Department of Elementary and Secondary Education and the decision of the administration to have each school district determine its return to school plan, the better part of spring and summer were spent by local districts to develop plans, negotiate agreements with local unions, and abide by the health and safety protocols. While superintendents have been strong advocates for as much in-school learning as possible, there are several realities which require the governor's help before many months of planning can be altered. Number one, convincing evidence that less than 6 feet of distance is safe. We need medical experts to explicitly coalesce around safe distancing, which allows for increased student capacity in classrooms. Number 2, school bus transportation must allow for significantly larger student bus capacity. We are limited right now with bus availability and the significant cost to expand bus usage. Number 3, help with collective bargaining provisions, since there is no way to make unilateral changes in previous agreements with local unions. Superintendents have already negotiated extensively on return to school plans. MASs and superintendents across Massachusetts would welcome any statewide efforts to address these issues that are beyond a local community's power to impact. With that assistance and support, we look forward to the time when more in-school learning is both feasible and achievable. And just to let you know where we are at, because I am definitely in favor, as always, when it's safe to do so, we want all of our kids back as much as possible. We have recently sent out a survey, a very quick survey to all of our families in the hybrid model, as well as the TECA program, to just take a quick dipstick. It's a non-binding survey to see where people are at. Because if you remember at the beginning of the year, for example, we had said to the TECA families who chose TECA that they could certainly be considered to rejoin the class in January. And we're already planning for that at this time. So once we get this initial data back, our leadership team is meeting to figure out what it says, what it looks like, what we can do, what we can't do based on the safety protocols that we have in place. So then after we get that first round of information, we plan to send out another survey that will be more of a choice that families have to make. And we would recommend that if, for example, if families are completely happy in the TECA program, then they can certainly say, I'd love to keep my child in the TECA program for the remainder of the school year. So that's the kind of information that we're gathering right now, because as you can well imagine, a lot of, to pull off a successful hybrid program takes an awful lot of planning, and the planning has already started for January. What I'd like to do, because we're doing that, is let's get through Thanksgiving and Christmas, the holidays, because as you know, there's lots of family gatherings, and we know that the numbers right now in the community are up. What I'd like to do after that is, once we get everything settled again in January, I'd like to revisit the conversation. I'd like to see where the data is at in terms of our numbers in the community, how many people in the district are quarantining. I mean, we're still dealing with a lot of that issue right now in terms of getting substitutes, having staff and students quarantining. Let's see if the dust settles a little bit mid-January to the end of January, and then I would like to seriously look at if the data says good, or if the medical experts say that we could go less than 6 feet. I would like to look at grade 2 as the next grade level to focus on and build that up. But again, there's nothing written in stone at this point. It wasn't an agenda item, but a lot has happened since the agenda was posted. And I think it's very confusing for community members, because, you know, we've been in the red Acushnet for the past several weeks, and all of a sudden this week we're in the yellow. It's confusing because it's a little misleading, as if our community has improved, when the fact is the numbers are higher than they have been. So we still want people to be really vigilant with the mask wearing, et cetera. And I have to commend our teachers and our families, because they've been really upfront and honest with us about some situations where their children have been able to quarantine, access their education from home. And I am super, super proud of our teaching staff with all of the work. I mean, this has been a complete paradigm shift of how teachers teach and how students learn. So I'm really proud, especially after hearing from the commissioner about the fact that some districts, even in the green and the gray, are still remote, full remote. Some districts, even on their remote days, there's no communication between the school district and the schools and the families. I believe our families feel supported and very connected, and that is because of the work, the great work of our teaching staff, our paras, our administrators, who are in constant contact with the families. We've got eyes on kids constantly. Our kids are happy to be back with us, and we want them back as much as possible. So that is the goal, but that's where we're at right now. So I just wanted to give everyone a quick update, and that's all I have for tonight.
Thank you, Dr. Bailey, for that update. And yes, welcoming any comments or questions. Go ahead, Mr. Tevz.
Thank you, Jen. Dr. Bailey, was in that survey that went out to the parents, was there an option to select full return to full in-person learning, just to get a temperature on how everybody was feeling about that? Was that an option in the survey?
No.
Okay. And then
I was gonna add, yeah, I mean, I think there was an other, and you could write in, but I personally don't think that that's necessarily intuitive, right? That I think some folks will get that and write in. I personally did, but I don't think that that's going to be intuitive for a lot of people to, it wasn't
all right.
clear.
And then I guess I just had some comments because you mentioned kind of uninterrupted learning on remote days, and I'm not sure that that's really, that's really impossible. And I just had some comments just because, my kids aren't in the district anymore. I'm sure, most of you are aware. I mean, they've been at full-time school since August 31st, 5 days a week, in-person learning. They're not at 6 feet. They're at, I think, 4 feet. They eat, at 6 feet in the cafeteria. And they've really had zero incidences, that sort of thing. And I just look at the experience that my kids are having, and I really wish that the kids of Acushnet were having that same experience. And by the way, the families too, having that same experience. I was a little bit disturbed by the comments that were made by the pediatrician in that press conference on Friday. And those are the biggest concerns that I have for the kids and the families of this district. And I definitely agree with you that we need to be looking at any way possible to try to get more in-person learning, because even if we can get everybody back on kind of that 4 days with the Wednesday still as a break, because the things that she was saying, the pediatrician with the obesity concerns with her kids, and then the fact that she said consistently week after week that the hospital census was showing more youths showing up for attempted suicides than we were having youth COVID cases at the hospitals. I mean, that's just, I was pretty alarmed by that statistic. And these were otherwise healthy individuals that were essentially broken by the hours of basically being alone behind a computer. And so I mean, those are the things that kind of motivated me to kind of want to bring that. I kind of circulated that video for everybody. So yeah, I agree. And I don't know the right timeline or when we're going to get the right amount of data, because there's been schools open around the world for 6, 7, 8 months now. And so, I don't know when the right time is for us to say, okay, now the science is, showing, that it's safe to return. I don't know if we're ever going to have 100% confidence on that, but I do know that we've got 100% confidence that our kids can't keep doing this. And the learning, I'd love to see maybe some assessments that have been done in the just from some benchmark assessments on some of these kids to see just how far behind they are, because we know they're behind. We just don't know how far behind, and for us to start weighing that in and say, what kind of damage are we doing here, if any, And at what point are we going to tip the scales where, we start making some different decisions for our kids? So that's just those are my comments on it.
Thank you.
Dr. Bailey, so one of the concerns I have with the timeline is there's clearly going to be quite a bit of lag, and I would appreciate any comments that you might have in terms of the amount of lag time it would take to be able to adjust to back to school learning. Let's just assume that we get the data or we feel safe after the holidays. So is it possible, or why can't that work start now to start to put the plans in place? And then assuming we come out of December and we feel good, we're in a good place in the community, we can more quickly move to that potential option. Because I'm worried that if we wait to assess the situation until January, the amount of lag time that it's going to take to make it happen, we're going to be at, I don't know, February, March. And at that point, it's like the school year is almost over.
Yeah, I agree with you. The amount of planning to put into a hybrid model that we've done over the summer and into the fall was a huge amount of hours. Just to give you one example, just doing the seating charts on the bus and making sure that those kids, I mean, we have a couple of buses right now that have waiting lists because we can't utilize every seat on the school bus. So now we may have some families that may choose or want to come back from TECA, and we may have vice versa where parents are feeling uncomfortable with the situation. They may want to put their kids into a full remote. I'm not sure. So we just wanted to dipstick and test the waters a little bit. Once we get that initial data back, we will have a better idea. I know that our leadership team already has scheduled meetings into next week to go over that data and talk about next steps. But if we make any changes for the second semester of the year, it will take us some planning again to get this right. I will tell you that there are some area districts that are actually contemplating going fully remote after Thanksgiving because they're worried about family get-togethers. And I feel like at this point, we need to continue with what we're doing because our families have been so good about communicating with us when there are issues with COVID-19 in situations. We're able to guide them. We've had the great support of our community, our Board of Health, our fire department, our fire chief with the testing. I feel like the community has really rallied around us and supported us with this hybrid model. Also to remember, we brought back our kindergarten and first graders more than the rest of the students. That's the goal. So we have to look at, will the medical experts say that 6-foot spacing, it's okay to go down to 3 or 4? We have to look at bus transportation because that, again, there's certain regulations that we have to follow. And then, of course, the collective bargaining agreement, which is already in place. So it's not like a very quick thing. It's going to involve planning with the teachers union. It's going to involve some planning at the state level with medical experts. But I'm certainly open to the discussion and have a plan ready. I think right now our first order of business is to get this information. Maybe there's not a lot of changes and we can really get into that next phase of how do we plan to get more kids back in. Mr. Tebs mentioned the idea of, say 4 days. Again, we can do that. It's just going to depend what the data tells us on that first survey back. And then based on that first survey, we're going to see what we can put together and send out another survey to families that will be a little bit more, for example, we want to know from the TECA families. I'm hearing a lot of good things from some people now that they've really adjusted and they feel like they're getting a rigorous education. They may love it and want to stay, and that's completely fine. I think our district will be more than happy to support them with that option. But we may have others. We've had a couple of situations where children have had to quarantine, but because they already know the teacher's live streaming and they're home for a couple of weeks, but they're still able to access their education. So we're open to just about anything at this point, but we're not ready to bring everyone back fully for the reasons that I've discussed But again, I'm not sure of the timeline until I get that data back and talk to some of the medical experts. And if they say, we can do it, my recommendation would probably be to start with one grade level. Let's see how it goes. Depending on the data again, depending on where we're at. I don't think this is going away anytime soon based on everything I'm reading and hearing.
And I understand the efforts that went into, putting together the hybrid model and the work that went into it this summer. I just think, again, this goes back to some of the conversations we've been having now for several weeks in terms of flexibility, is that I just think we get to January and we don't have the plan ready, the lag time that it's going to take, we're going to be past the point of no return, essentially, of being able to make any adjustments. And frankly, I think we all know, I know everyone's doing their best with the hybrid model, but there's no substitution for in-school learning. And I'm seeing it with my own kids, and I know I'm no different than any other parents. I'm just seeing a lot of bad habits that are being developed from kids that didn't have bad habits before. Not that no one's not doing their job, but that's just like, they're with their grandparents and they're online. Their grandparents don't know what's going on, right? And it's very easy to say, I'm going to shift from doing my online work to God knows what crazy game or app that, might be on the iPad because we don't have Chromebooks yet. And so we've got to try to be as flexible as possible. And I know there's a lag time here, but we got to try to be able to adjust as quickly as possible. That's just my opinion.
Thank you.
Yeah, I agree with you. Dr. Bailey, I know the letter that you read from superintendents, clearly there's a concern about wanting more data about the 6 feet distance. Is there a concerted effort by that body to really nudge the state to say, get on this? Because to Ron's point, we need to start making plans. So if we find out 3 feet is safe, we need to figure out what that looks like as soon as possible. So
I think there's nothing more that superintendents or teachers or any educator, frankly, would want is to get our children back full time. Quite honestly, to have the teachers doing what they're doing now, the hybrid model is challenging. There's a lot of challenges with that. It would be easier just to have everybody come back. We just need to make sure that we can do less than 6 feet. I'm assuming we're still going to have to all wear masks. We have to make sure that we can properly seat kids on the bus, and we would have to work with our teachers union on a new, but again, that MOA will be based on what the experts are recommending for public schools. And it's disappointing that the state, and I know they're doing their best, but they're up and down with the information and it keeps changing. It's very confusing for families. And we're all trying to adjust and pivot as the new information comes about. The great thing is that Acushnet, from the get-go with this hybrid model, the teachers have been extremely willing and able to learn a new way, and we've been able to do that with our Wednesday professional development, where many districts are not even doing the live streaming. So I feel like we've got a couple of steps ahead, but now, to Mr. Hood's point, what's our next game plan in terms of how can we get our kids back? But we definitely need the medical experts to come in and say, you guys are good to go. Less than 6 feet would be safe. And then we have to work out those things. I think once we get that information, I think it could be relatively quick, getting an MOA, but again, getting the medical experts to say that it's okay to go less than 6 feet. That's the biggest challenge right now. And they're less than 6 feet on the bus, actually. They're spaced out on the bus in a way, we still can't fit all the kids. And I have to say, the Acushnet families have been wonderful about driving their kids to school. We've been able to make some changes based on requests. We're doing our best with all of it. But I think based on what's going on now with the organization of MASS, Massachusetts Association of School Superintendents, with the holidays coming up, I don't think it's realistic to think that before Christmas, we're going to be able to get everybody back in school. I just don't think that is a realistic plan. I would say after the holidays, though, we should definitely, and we can talk about it beforehand to have a plan in place, but even I don't even know what the new plan will be based on this new data that we're getting back from families. We kind of want to take the pulse or the temperature, if you will, of what families are thinking right now. And we did not put in full-time because again, that could be very misleading. We're not ready for that at this point in time. I personally think most people would jump at that, except for those that are really nervous about the virus. It is challenging to have kids doing both, and I appreciate, it truly does take a village to do this model, and I appreciate everyone's support in working with their children at home right now.
I presume that maybe those folks who are super nervous, and I appreciate, trust me, I want the kids to go back to school full-time safely, and I want it to be safe for everybody, kids,
Sure.
teachers, administrators, right? This is a public health crisis, and we have a responsibility to try to keep everybody safe here. You know, but I presume that the folks who maybe are super nervous about it may not have sent their kids back in for the hybrid, right, to begin with. And so, and I do think at some point, you know, we do, and you're right, I think when the data is clearer, what we're going to get from that survey that went out yesterday or the day before is not going to tell us whether folks are willing to send their kids
No,
back.
it's just a little piece of information. I can tell you that some of the families who did send their kids back, it was based on the fact that kids, we have these safety protocols in place, and families did feel safe sending their kids back 2 days a week, 6 feet apart, you know, all those kind of protocols in place. I've had many phone calls because parents were on the fence. And again, I can respect anybody's decision on what they would like to do and the choice that they want to make for their child,
Yeah.
you know. We all, as educators, cannot wait for the time that we can get every single one of them back in front of us. I mean, the best part of all of our days is being in front of the kids and seeing them. But I will tell you, I am very impressed with the kids at home learning. They are so engaged. I've walked through classrooms, I've interacted with the kids at home, with the kids in front of me, and I am very impressed with what the teachers are doing. And I can tell you a quick funny story. Yesterday, we had a fire drill, and our facilities director was walking around to make sure, he wanted to make sure that the alarm was loud enough in all of the rooms, and he heard some children, he thought maybe fooling around. So he went into the room thinking they were still there, and it was the kids at home. They were still on, they were talking to each other during the fire drill. So the great thing is that we have not had any major problems with kids not logging on, kids not being engaged. And the minute we see an issue, I give a lot of praise to our teachers who reach out to those families, because I do feel that we've got a strong connection going right now with our families. We're very blessed with this community. We're in a good place for what it is, but I know in order for us to be in a better place, the goal is definitely to get the kids back.
Ms. Gomes, did you have a comment?
Yeah, just a couple of questions regarding what Dr. Bailey had said. So we keep mentioning, you know, the medical field to say that 3 feet is safe, right? We've been talking about that for months. Right now, you know, if they did take a survey of the hundreds of schools that are at 3 feet right now, you know, are they spreading the COVID disease being 3 feet apart? I mean, that's a survey that could possibly be done. The other question that I had is, again, in the medical field, who are we turning to? Right now, we have people in the medical field that are saying 3 feet is perfectly safe, but we're us as the district is disagreeing with that. So can we just be more specific on who exactly are we looking for, or to tell us that 3 feet is safe, just so parents in the community can know that, okay, when this person or this group speaks, you know, this is when we're going to move forward. Because as of right now, listening to everybody speak, I'm still not sure who are we waiting for to say it's okay. Because right now, you know, you have the governor saying yes, you have Desi saying 3 to 6 is okay. You got pediatricians half say yes, half say no. We really need to, at this meeting, I think, just, or at least maybe the next meeting, like who are we going to determine, or who are we going to nominate as the person that we'll listen to go to the 3 feet, to get more kids into school. That's question one, or comment number one. The other one is, for the hypothetical of getting all the children back into school, I mean, could we, Dr. Bailey, state that maybe by January 5th, that meeting, we have sort of a hypothetical of how to get our kids back? Can we put a date on this? Where again, strictly hypothetical, how are we going to do this? Regardless of if we're still red in January or what happens over the holidays, I would really like to hear a hypothetical on how we're going to get these kids back by, I think January would be fair, but the committee, please tell me, like, what are your thoughts?
I mean, I would just initially say, Mrs. Gomes, as soon as possible, as soon as we iron out some of those things. And I think it's very hard to put an exact date. When we meet with the commissioner, oftentimes he'll have the lead person from DPH or different epidemiologists, doctors on the call with us, directing us on these phone calls. So it's not always the same person. But I can tell you that across the state of Massachusetts, the greater majority of districts are doing 6 feet of public schools.
Of the public schools.
Correct.
But there are hundreds of private schools that are doing the 3 feet. I don't think we really should distinguish between public and private when it comes to this, because 3 feet, 6 feet, it's still a disease no matter what district you're in. And, science is science. So I would really like to get things more firmed up so we can just be rest assured as a school committee that, things are going to get answered. I know we're all trying to do it as hard as we can, right? We're all trying to figure this out.
Mm-hmm.
But I think if we get some solid dates in there, we're more apt to move forward. But again, that's just my opinion.
Like I said, I would hesitate to really make that plan before the holidays based on what I'm hearing from other superintendents who already are talking about going remote and having the number of staff people out already quarantining because the numbers are going up. I dealt with it all weekend. Families have been in touch with me, staff members have been in touch with me, and we guide them on next steps in terms of quarantining. So I think we've got 2 major holidays coming up, and we know that there are usually family gatherings. I would ask people to, use good judgment and, adhere to the policies and regulations that the state has put forth to keep people safe. But there could potentially be a spike after a holiday. I hope there isn't, but there could potentially be one. So while we're planning on making a slight change possibly, and again, it's going to be based on the data we get back from families, I would say right after that, our next move is to have a plan in place when it's safe to do so to get our kids back. And if that means 1 grade level at a time, if it means certain days of the week, whatever is a good plan that is safe for our children, I'm all about it, because the sooner we can get them back, the better.
Can you, Paula, just go over then, again, all right, so we don't have a hard date. But what about who are we listening to for the science and the safety? Are we talking about DESE? Are we talking about CDC? What are we thinking?
So I think that's why it's so confusing, to be honest with you, because the CDC often will say something, the World Health Organization will say something different, DESE will say something, the governor will come up with something, the local board of health. So what I really try to do is balance everything, but we meet weekly as superintendents with the Commissioner of Education, and oftentimes he will have medical experts speaking to us about the recommendations for children in school. And those are recommendations. He's left everything up to the local decision-making groups. And I always try to look at what other people are doing. I think that's been tough also, the fact that it's left up to local decisions, and then you have all these districts doing different things, and you have maybe a teacher who works in one district, but their kids attend another district, and they've got to figure out daycare. I think this has been a big problem in the way perhaps the state has handled it, but I can't control that. What I do is listen to who they put on the call, and I can tell you the information is constantly changing, just like they made a change with the metrics based on the size of the community, based on you could have a nursing home, a jail, a college in your community, which could really increase your numbers. And I know it's sort of like fixing a moving train, if you will, right? They're trying to figure it out like the rest of us are, but it's too bad that that particular metric wasn't at the beginning, because like I said, our numbers are up right now in Acushnet, so it is a confusing message when you go from several weeks of being in the red, and we're at a very high number, and now we're back to yellow. So my message would be, we still need to be vigilant in what we're doing. It doesn't mean, in my opinion, that all of a sudden there's less people who don't have COVID in the community. It just means they change the way they're looking at the metric. And I'm going to be learning more about that. It just is new for all of us. But I do think it's very confusing for people in the community. And I know when this press release came out, I had one parent call and said, great, when are we going back to school? And it's not, unfortunately, it's not that easy, but it's frustrating when you have people at the state level kind of doing this. All of a sudden, we're going to make an announcement and without considering the details. And I will tell you, when we met with the commissioner, we met with him about an hour before that press conference on Friday. We met with him about, I would say, 12:30. The press conference was either 1 or 1:30. And basically his message to us was, nobody should be fully remote unless there's in-school transmission. He did not discuss the full in-person. He said you still have to adhere to the regulations, the guidelines. So I think he's understanding, but I think there's lots of pressure from people, whatever. There's so many different people. And as a superintendent, it's a very difficult place to be in. But I will tell you that I work with everybody to always try to do what's right and safe for our school community. And I think that Acushnet right now has done a phenomenal job, because we have not seen any transmission of the virus. Now, does that mean that perhaps we could go from 6 feet to 4 feet? Perhaps. It would be nice for a medical expert to say to us, hey, why don't you try it? I think it would be safe. I'm not that person, but I would like to have that conversation sooner rather than later. And I would almost like, I know I have teachers who would be willing to try it. It'd be interesting to see if we have families who would be open to it. But those are all things that we're going to be collecting data on and working on. So I would ask for your patience, because it's not a simple decision that happens overnight. And I know, unfortunately, the reality is that there is lag time. But the goal is to get kids back safely and as soon as possible, but in a safe manner. And, the things that Mr. Tevz referenced with the press conference from the pediatrician, those things are extremely concerning. I know that the DCF numbers are low right now. The referrals are low. The soup kitchens, the food pantries, there's a shortage because, children are not eating. What I will say that in Acushnet, we have been supporting our families. We've been doing the grab and go meals. We've been in touch with families who need additional support. We have our people calling families if we're not seeing them. I'm really proud of the staff who work in Acushnet and the amazing work that they're doing. When I walk around these classrooms and I see the interaction and engagement for what this is, it's a proud moment. And I wish you could see it and experience it for yourself, because it is the best part of my day, because I am amazed at what the teachers are actually able to pull off, because it is a challenge to do this. But I mean, we're really watching these kids carefully, because we don't want our kids to fall through the cracks. And some of those statistics were very concerning.
And just to clarify, the current DESE recommendation is a very general 3 to 6. They're still at a 3 to 6. Is that?
So, and I have to tell you, it changes depending on who you talk to. So we've followed more of the CDC, the Board of Health. We've consulted with them, and the fact that the state has mandated the 6-foot distancing, we want to adhere to all of that right now. We feel like it was best to start out tight and strong, but now perhaps after a few weeks, and if the data is looking a little bit better after the holidays, it might be time to pivot into something different if we feel it's safe to do so.
Okay. Any other questions or comments? I do want to move us along because this really isn't on the agenda, but go ahead, Mr.
All
Tebs.
right, I just want, I think that Commissioner Riley, I guess he was asked because they had said in that press conference they wanted a return at, as close as 3 feet, and then Commissioner Riley, I believe, was asked in a question by a reporter or somebody if there was going to be any disciplinary action to districts, and he didn't really comment on it. So he left it open in terms of possibly handing down disciplinary action. I don't know if that meant like maybe some of these districts that are full remote, but but I don't know. I mean, because they were talking about everybody. They said we want everybody who's not showing infection going clustering happening in schools. We want you full in person. So I think that as a school committee is something that would be, or certainly as a superintendent, we should be concerned about potential I don't know what the hell, what would they do? I don't know.
Yeah.
But
I can respond to that, Mr. Tevz, because for the last several weeks, the commissioner has been talking to us about the complaints across the state, and he has really referenced those districts that are full remote. He's also talked about districts that on those remote days, there's no interaction at all. He gave us very specific guidelines at the beginning of this to say, even on the remote days, you are required to take attendance. You are required to check in. I put together when we did this data collection for the state, exactly how many hours we were doing of synchronous and asynchronous learning. I believe that Acushnet is very well aligned to what DESE has regulated. They did put out a list of districts who they were concerned about, and the impression that I've gotten through meetings is that they would be talking to districts that they had concerns about, and I truly, honestly, do not believe that we are one of them at this point in time. As a matter of fact, I would like to think that we're leading the way with a lot of our live streaming that many districts have refused to try. It's not an easy thing, but I commend the people who have been willing to take a risk and try a new way of teaching and learning. And I will say many children, the feedback that we've received, love it. Many do. But I agree with what somebody said earlier, there's no replacement for getting the kids all back in person. That's the best way.
And is it possible, to echo Ms. Gomes' comments, is it possible to get some understanding of what's happening in some of the private schools that are back full-time, like the school that my kids go to?
I don't know. I mean, what do you want me, is the committee asking me to?
I'm just wondering if there's any data one way or another that there's spread happening in those schools, or there's not, or there's no discernible difference between the public schools and the hybrid infection rates versus I was just curious if there was any way of kind of collecting, not us, I'm not asking you to do it, I'm just curious if there was any larger bodies that were kind of collecting that data.
So being a public school, it's very easy for us to access other districts. We have listservs that we can access through email and get information pretty quickly. We do not have access to other private schools. So it's not as easy for us to do. I also would say that the conditions in private schools are probably a little bit different in terms of the regulations. They can probably do things a little differently than what we have certain guidelines and mandates. It may be different. Again, I'm not really sure as I don't work there. But I definitely agree that this is a great discussion, and I think we should keep the discussion moving forward. I would just ask for your patience. Let's get some more data from our families, and that's what we intend to do this month. And I want to speak to, I'd like to see what comes out of the MASS statement that they released today. They're pretty much asking the state for information on these three things from the medical experts. I would like to see what the outcome, this just came in close to 3 o'clock today. So this is an evolving situation right now. But, you know, to the families listening at home, we want nothing more than to get your children back in school. We just want to do it safely. So we are going to be working out the details as best we can.
Yep, Ms. Combs.
Is it possible, Paula, for the next, I know you had mentioned that you didn't want to put the full term back for parents to be able to survey the parents. But when can we survey the parents, do you think?
We could ask a question.
Yeah.
If things were safely in place, let's just say, we could word it in a way that, would you send your child back if the recommendations by the medical experts were such that, you know, we could lessen the social distancing? Would you be in favor of sending your child back? Like, we're definitely open to asking those types of questions, not on this one, because we just wanted to see
Right.
we're at. But on this next one, it might very well be a valid question for us to ask.
I really think it's important as a committee member to know what our parents are thinking and how they're feeling, and to ask the specific questions. Just referring back to the ATA's letter of their surveys, I mean, you know, should people's, you know, let's see, people feel safe. People feel staff should wear masks at all times. Like, obviously, yes, they should. You should wear masks at all times. I would really like to ask questions to the parents that are not spun, that are legitimate and really, you know, adhere to what we're trying to make happen, and that's getting back, you know, the kids into the school. You know, some of these questions that surveys ask are just, they're like loaded questions, like, do you feel safe playing in traffic? Obviously, the answer is no. So, you know, let's ask specific questions to these surveys and ask as many questions as we feel necessary to just, again, get the true temperature of what the parents and the community is feeling. So.
Are you saying that the surveys that the district sent out, the questions weren't?
I'm saying that the questions that our district sent out to parents were 3 simple ones.
Yes.
It would have been nice to just maybe get a little bit more detailed. Like, for example, you know, would you feel safe with doing hybrid at 3 feet instead of 6 feet? You know, something along those lines, just to get some true numbers and not ask such general questions. I think that might be helpful in just feeling how people are feeling in our community. Again, I was just using that ATA letter because it just blew my mind that the survey questions, obviously those are answered. Those are absolutely accurate. But those aren't the questions that we need to be able to determine how we are to run the district.
Well, it sounds like the intention, if I'm hearing correctly from Dr. Bailey, that there will be a second survey soon, and this will be a lot more detailed. So
thank you.
Welcome. And I just will reiterate again, it's always our goal to get our children back. I mean, this is challenging to do school like this, right? There's nothing more we want. We just want to do it safely, as the rest of you want. And I will be in constant communication with folks from the state and all of our stakeholders to see what is feasible. And, you know, that's the big word, feasible, if feasible, for our options. So we'll try to make it work as best we can.
all
And
right.
that's all I have.
Okay, great. Thank you. Mrs. Flynn, your report, please. Business manager's report.
Okay, thank you. You all have my report in your packet. I'll go over it briefly, and of course, if you have any questions, we can take those up. You have several reports. I'll start with the one that looks like this. It's called Budget Update to the School Committee. Now, for the members who have been on the committee for a while, they're familiar with this format. And what I do throughout the year, throughout each month, is take our larger budget accounts and just see where we're at in terms of how we budgeted for it and what's actual. Now, this year it's been a big challenge because certainly we didn't budget for a lot of these things when we weren't even thinking that there would be a pandemic when we started our budget process. So there's a lot of changes. But overall, right now, we're in very good shape. We do have an anticipated surplus of almost 500,000, and that's due in large part. I'll just quickly go through salaries. We have several unfilled positions: AES principal, nurse, and ELL positions. So as we fill those, if we fill those, you'll see that number changing. And also we have some contingencies for those. You'll see a contract nurse. I put that in. That's the cost of what we would have to pay a contract nurse for the entire year. So if we fill it with a full-time nurse, then that will go away and hopefully balance out. Same thing with, we have some administrative support at the elementary school for the principal, for the acting principal, and actually working with our director of curriculum, who is our grants coordinator. We're seeking to support that through a grant, through the Title IIA grant. So you'll see some changes as we go through the year. Some other changes due to COVID, unfilled after school activities, just activities that unfortunately just can't happen. And we had budgeted for those stipends. So that's part of our surplus. We also have a salary deficit due to the positions that we had to hire for, the 4 building-based subs, the 2 full-time custodians, and the part-time custodian. Some of that you'll see on my report is being supported by our CVRF grant, and some of it isn't. So the salary deficit due to COVID of all those new hires is 142,000, but that's balanced out by the salary surplus that we just spoke of. We got our first of 3 invoices from Fairhaven High School. And you can see that we budgeted for a few more students in actual, and some of the special ed tuitions were less than what we had thought they would be. The needs are not as great as we thought. I'm still awaiting the New Bedford High School tuition, so hopefully at our next meeting, I'll have that to put in there for you. School choice tuition, those numbers come out from the state in December. So certainly by the January meeting, I'll have that updated to see how we're doing with school choice tuition versus what we budgeted for. The next one is our TECA tuition, the deficit due to COVID. Now, of course, we didn't anticipate this in doing the budget. You'll see the figure that I put in budgeted for is we were charged for 103 students for first semester. And right now enrolled, we have 85. So if we continue second semester, I just put 85 in for second semester. So that will have to be adjusted as we go forward. But some of that will be offset by our coronavirus relief CVRF grant, as you can see. Out of district tuition and transportation surpluses, we've had quite a few changes. We've had about 4 students who were budgeted to be out of district who are either no longer Acushnet residents or are homeschooling or have otherwise been remote. So some of their costs have not been realized. So you can see in terms of out of district, for tuition, it's about 235,000, and for transportation, 341,000. So that's the big bulk of our surplus. And also for transportation, we had budgeted to have preschool transportation, but that was since removed from service, and also a shortened school year for transportation. Some programs do not have extended summer services, and nor do they started maybe 10 days late, and they may not be going the full year. So I'm working with the Student Services Department to really fine tune those numbers to the next, for our next meeting. We also have, we don't have any McKinney-Vento right now, any homeless student transportation, so that's part of our surplus. And finally, in district transportation, we've had some additional costs that we've talked about, that additional Fairhaven High School dismissal and the decals for the seat numbers. And that's being partially offset by our CVRF grant. And finally, I put in the other unbudgeted costs due to COVID. So there's supplies and services, not salaries, that have come up. And you'll see on another sheet, it's a 3-page sheet that is kind of colorful. I don't know if you got it in color. It lists all of our COVID expenditures broken down by how we're paying for it. So this is just a tracking that I'm trying to keep up with, just to track all of our expenditures that are either being paid for by our ESSER grant, our CVRF grant, and the detail is all in your packet, or the town cares money. So I've been working with the town accountant. They've been working diligently to get some of these costs reimbursed and our budget credited back. So those costs are not, they don't always get reimbursed one for one. So I really don't have an accurate prediction of what's going to be coming back for any of those costs submitted, but certainly, as I know, I will include them in my report. And finally, you also have, I included a sheet on revenue shortfalls. This is important because we rely on the preschool tuition to pay for the salaries of a teacher and a para in our preschool program. And we also rely on our school building rental account to pay for some of our unanticipated or outside the budget expenditures for our buildings. So because of the, we don't have as many students participating in the preschool program, so their tuition is down. You can see I did a 3 to 4 year comparison as to what was actual versus anticipated for this year for both funds. And I also included the expenditures from the school building rental account over the past 4 years, so you could get an idea. I believe at the previous meeting, that was one of the questions that we discussed, was what are the types of things does that fund pay for? So this gives you a good idea of what that fund pays for over the past 4 years. So those are those reports. Does anybody have any question on any of that before I move on to grants and operations at all? Okay, good. So then the next thing I included, I talked about in our last meeting, was a summary for you of all of the grants that we received from the Department of Elementary and Secondary Education. So you can see the amount that we're receiving in FY21 compared to what we received in FY20 and what the change was, plus or minus. And there's a description of what all the grants do, what they support. So for example, if we take the first one, Title IIA, and I'm looking at this report now. Title IIA is what we call our it's improving teaching and learning. So it provides supplemental resources and support systems. And the funds are primarily used in our district to pay for mentors, what Mrs. Betancourt just talked about, for new educators and administrators. Sometimes when funds allow, we can have funds set aside for teachers and staff to go to professional development workshops. I can tell you that for this year's grant, the entire $17,903 is being spent on mentors to our new teachers and also the administrative support at the elementary school. So you can read further about the other types of grants that we have. The 2 new grants are on the next page, the ESSER and the CBRF, and those were as a result of coronavirus relief funds. Those are all entitlement grants, so the districts get them, we have to apply for them, and we have to say how we're going to use them, and it's a lengthy application process, but generally, as long as you comply with those, the districts do get those grants. And we rely on them and we plan on them in our budget process. So that is it for finance. I'll move quickly into operations. Transportation, as Dr. Bailey alluded, we have we're on a waiting list for one of the buses at the elementary school, and several other buses are almost at capacity. So as we were discussing this, I took a look at the updated bus counts from Amaral Bus just to see if we were to come fully in person, what that would look like. And right now, we would have great difficulty with the buses because most of the buses, unless the rules change from Department of Ed, most of the buses are between the 2 cohorts over 25 students, and that's what we're allowed to put on a bus right now, is 25 students, 1 per seat. So we only have 2 buses at the elementary school and 2 buses at the middle school out of 10 runs that would be able to accommodate both cohorts at the same time. So that would be something that we would definitely have to either have some relief on the regulations for, or have to do some additional planning for on that one. We've begun discussion with Amaral Bus, and this is a topic that's been very timely for all school business managers and school districts over, okay, what do we pay for the bus contract? And I know we spent a great deal of time last spring discussing that. But you know, we need to discuss with the bus company what are we paying for those first 10 days of no service? What do we pay for the remote days? And I will say for us in Acushnet, It's an additionally complicated because we have to follow, because we don't have a high school, we're following the school schedules of other districts. So on days such as Wednesdays that we don't provide bus service into elementary and middle school, we're still running a good amount of our fleet out to our various schools that we provide to. So that's an additional complication. So that's something that we will be working on over the next couple of weeks. Finally, for facilities, as Dr. Bailey mentioned, we hired our second and final additional custodian. So right now we have 4 full-time custodians at each building and a part-time custodian shared between. They work 4 hours overtime on Sunday on either special projects or the deep cleaning between the cohorts as they do on Wednesdays. We continue to do work on our HVAC components. We're entering the time now that as the heat comes on and we're realizing that, okay, maybe since last year a motor has gone, our fan has gone. So we have additional, complications for that, but those are expected. We always have a lot of repairs on motors, actuators, and valves. Our equipment is almost 20 years now, so we can anticipate that we need to continue to keep up with it. I'm happy to say that we just received our second round of 28 air purifiers today. The truck pulled in today. So we had ordered 68 of one particular kind and then another 10 to 15 earlier here and there for rooms that absolutely had no open windows. So we're hoping to receive reimbursement from Town Cares for these purifiers. And we also have ordered filters to replace them eventually. I also included the what Department of Ed had released an updated FAQ on classroom ventilation. They continue to advise that the windows should be open to the design permits and as feasible. As we get into colder weather, it's going to be more difficult, but they're still advising to try to keep the windows open, at least a crack, to have some fresh air supply. And we're trying to, control the heating system to provide maybe more heat to offset some of that cooler air. So that's a work in progress. Department of Ed, says to consider using portable HEPA air purifiers, and we will have those in all of our occupied spaces with the delivery that came today. And they continue to advocate for masking, physical distancing, hand hygiene, cleaning and disinfecting, and contact tracing. So I think, as someone who is here on a daily basis, I can tell families that they can be confident that we do continue to provide, prioritize all those every day. So we continue to try to do the best we can and to do better. So finally, the Board of Selectmen and Finance Committee met and they approved the AES roof replacement article for consideration at town meeting. And that's this Saturday, November 14th. And if town meeting approves the funding, we will begin the bidding process for anticipated summer 2021 construction. So that's all I have. I'll certainly be happy to take any questions that anyone has at this time.
You're on mute, Dr. Bailey.
Thank you. A quick question regarding the transportation contract for this year. Would that be something at this time that the budget subcommittee should be having a meeting at this point?
Yes, I did recommend that.
Okay, so I just want to let those folks know that I will be sending out an email to get that going. Thank you.
Ms. Flynn, regards to the transportation, if we're hypothetically getting into conversations about, the plan for getting more kids back to school, without a change on the bus policy, would it be perhaps possible for us as a district to say that we were providing transportation for everybody outside of a certain radius from the school, say like a mile or 2 miles from the school, that sort of thing, and make the buses work, in that respect? Is that something that would be possible or within the scope of the current contract that we have with the bus company?
Sure. That certainly is possible. We would have to make sure that we adhered. There's a school committee policy on the distance, and there's also a state law on the distance. So we would want to double check that and either adjust our policy or make sure we're adhering to state law on how far we have to transport from. Okay, so that's the first thing, but that is a possibility. We do transport most of our students, even students, that are living just outside the school. It's always been the belief that if the bus has room, and this is the first year that it does not, the buses have room, we would pick up kids on the way, because the thought has always been that Middle Road is not, there's no sidewalks. So for the safety of all, we continue to provide bus service. But that certainly is, Mr. Tapp, something we could consider. There's also, we could look at, who by law we have to transport. And we could also consider what it would be to do a second bus run. So you might have to do one bus run to pick up half the kids, and then do one right again to pick up the next half of the kids. So that would require a lot of planning, of course, and it would also require some consideration to the timing and the start of the school day and supervision. So these are all things that over the summer we considered when we didn't know what the plan was and we didn't know what our regulations were. So we were trying to just plan for everything. But certainly, there are some options. It would be a challenge. The bus company worked really hard and long on all of these routes, and knock on wood, we haven't had. If anyone has any complaints about the bus, none of them have really come to my level, maybe except for one or two. So the bus seems to be running smoothly. We have assigned seats on all the buses now, permanently assigned seats. So those are useful when we have to do some contact tracing, because the regulations say that kids can sit one per seat. And on our buses, those seats are less than 3 feet, slightly less than 3 feet apart. So the distance that those children are on the bus is slightly less than 3 feet, but they try to stagger them. And as room permits on some buses that aren't full to capacity of 25, they may not be as close. So that's, that is a big challenge.
Mr. Sumner, you had your hand, and then Mrs. Gomes.
Yeah, Paula, if you're gonna send a survey out to see how comfortable families are with bringing their kids back full-time, is it possible to include the question of how many families would be willing to drop their kids off?
Yes.
Yeah, that was helpful to us in the summer when we set that out, because that gave us an idea of, whether we would have to start planning for a double run or not. Unfortunately, it worked out that we didn't.
I don't think it's feasible to do double runs. I don't even think that should be part of the planning. It's not economical, and it's very time consuming. I was going to ask the same question, Craig, to Dr. Bailey, if we could add that to the survey, and then just find out what the COVID guidelines are for the state with transportation, because I'm assuming that they've made them more lenient, where we don't have to. No, they haven't. You still have to bring the same amount of people, no matter what.
That's why right now MASS is pushing the state. Transportation is one, The governor is now saying send kids back if feasible, but we have some obstacles and challenges that we have to overcome, and transportation is one of them. So if they loosen the restrictions and it's safe, then we can put more children on the bus. Another issue that we looked into at the beginning of the year because of all this is to see if the bus company had additional buses, or if we could contract. I mean, I know, Mrs. Flynn, we've talked about it, and that didn't seem like an option at the time, because every bus is being utilized by every district in the same way, right? So it seems like it's still an issue.
Okay. Well, thank you. Again, adding that to the survey, I think, is going to be key. And then, unfortunately, if we have to push out the two mile or the 1 mile, whatever the state regulation is, then that's what we'll have to do to get our kids back. Thank you.
Any other questions?
Jen, you're muted.
Oh, gosh. There were some letters to families that went out that are noted in the agenda on point 6 on our agenda. So I just want to bring those to your attention. Nothing there that we need to.
Actually, I had a
on
comment
or-
on that, Ms. Downing. The letter from November, it was the 3rd?
The letters that are noted there are October 22nd through the 26th, it looks like.
I thought there was one that I read, and I was just gonna give a comment on it and say I thought it was so much better. It was a really good letter that went home.
There was a November 3rd letter. That was the one we
Okay.
sent out today. Yep.
The tone, I felt like the tone in that letter was like really good. And really, like, it was very short. I don't think I thought it was great. So I just wanted to give some positive feedback to Dr. Bailey from that. So
Thank you. We also added under communication and information, an article that I believe was in Sunday's paper on the little toy. So I want to just give a shout out to Mrs. Gomes, who's been a leader working with the committee on the little toy. But if anyone has driven by the little toy, you will see that there's been quite a bit of progress. And it looks really good. I know that we're doing some finishing touches, but there was a really nice article in the Standard Times. So I want to point that out and thank everybody, because it's really been a community effort. But when you think about what has happened in a very short amount of time, that is a phenomenal project for this community during a pandemic, during what, two years, really, that it's come to fruition. So we're so close. We're working out some last minute details, but I just want to shout out to Mrs. Gomes and the entire committee for their great work with that. So I did include, because the article just came out, so it didn't make the agenda, but I thought it was timely to stick it in the packet.
Thanks, Sarah.
Yeah, well done, Sarah. You've really taken a lot of leadership in terms of on behalf of this committee to see that project comes to fruition. So thank you for all your hard work and passion around it.
And I just shout out to the fundraising committee that helped with that. It didn't make the article, but I definitely want to thank Susan Beck, Scott Johnson, our new acting principal, Erica Chevalier, Jamie Alves, Margaret Vieira, Casey Coelho. I mean, those people literally we met twice a month, sometimes three times a month, to organize some of our big fundraising events, and hours and hours and hours of at home doing God knows what with putting these things together. So without them, the amount of money that we raised is greatly appreciated, and just thank them all.
I think when we get the project finished and children can play on it, I'd love to see some type of a ribbon cutting ceremony, Mrs. Gomes, because it is quite an accomplishment and quite a project, and it's beautiful. If you haven't stopped by, I would encourage you to take a peek, a walk around the playground. It's really, really nice. Super, super job. Thank you.
We just have to figure out how to get those basketball courts done.
I'll put that on my calendar, Ron. That'll be my next project.
I'm in for that one.
The obstacle courses that were added to the tennis court areas,
Oh, those are cute.
the sensory obstacle courses, the kids love them. And the plan is to put a couple more out on the AES playground on the pavement where the little toy is, but we wanted to wait until all that work was finished so we could get a fresh coat of paint on there. So the kids love it. And I want to thank our OT. She had a lot to do with that, Mrs. Rachel Judge. So shout out to her for getting that done.
Excellent. All right. We do not have executive session today. So if there are no further comments from our committee, may I ask for a motion to adjourn our meeting, please?
Make a motion.
Second.
Any further discussion? Seeing none, we'll go into a roll call vote. Kelly? And I should mention before you do that, that our next school committee meeting, and I just closed my agenda, so I don't have the date, but I do want to mention it. Here it is. Sorry, okay, here we go.
Tuesday, December 8th.
Yes, thank you, thank you. The next school committee meeting is Tuesday, December 8th at 5:30, and we will presumably still be on Zoom at that time. So, I'll go ahead, Mrs.
Okay.
Benavides.
Mrs. Gomes,
Yes.
Mr. Sumner,
Yes.
Mr. Tevz,
Yes.
Mr. Hood,
Yes.
and Mrs. Down.
Yes. All right, thank you, everyone. Have a great evening.